I'm Dr. Janusko, physical therapist at Magnify Health at CrossFit 904. One thing I think we do differently at Magnify Health is just our ability to focus on the patient's programming through one-on-one care. Being able to see somebody one-on-one for an hour gives me the opportunity to make adjustments throughout every single treatment session multiple times. So if somebody comes in and they're having pain or discomfort, and we run them through what I expect to make them feel better, and it doesn't, we're able to change that on the spot, readjust the plan, and incorporate a different exercise. If I was working at a outpatient clinic, there's a good chance that I would have to pass that patient off to a tech or an aide to go work on another client, and they might just tell them to kind of push through or work through that exercise, opposed to being able to give that individualized one-on-one care or one-on-one focus to the patient. Also, one of the big things we like to do is incorporating the manual therapy in relation to what we're expecting to get out of our strengthening portion. So everything we do, as far as whether it is squats, deadlifts, any of the Olympic lifts, everything should have a progression and regression based off of where a patient is. The manual therapy is something that should help improve your ability to work on a regression towards a progression, opposed to something that's going to create a long-term change. The manual therapy is something that creates a window of either decreased pain or increased mobility to allow us to progress a patient into the next progression of a specific exercise. So if somebody is looking to get back to a squat variation, or they've been told by a different provider not to squat, what we'll do is we'll regress that squat to a position to where they can tolerate the load without being in pain, and then gradually move them or progress them back to the movement pattern we want to get them to. Dr. Janusko, physical therapist at Magnify Health at CrossFit 904.